an instructional video on the conduct of community awareness and sensitization on COVID-19 for community volunteers, CHIPS, VCM and Corps. As a community volunteer, during your routine house-to-house visits, you will sensitize household members on preventive measures against COVID-19. It is important you pass correct information from health authorities to your community about this infection. It is also important to observe the following safety measures during your community engagement activities. Maintain a distance of at least 6 feet or 2 meters from everyone, irrespective of their risk or exposure. Do not conduct your regular activities that involves physical contacts during your home visits. Wear masks always. Community members should know COVID-19 is an infection caused by a virus. It spreads from person to person through droplets or saliva from coughing and sneezing, touching contaminated objects or surfaces. Symptoms include cough, fever, and difficulty in breathing. Contact with a person who has tested positive puts you and others at risk of being infected. There is no treatment yet, but symptoms can be managed. Some infected people who do not become sick can still spread the disease. It is equally important for community members to know that COVID-19 can be prevented by frequent washing of hands with soap and running water, especially after returning home, after touching surfaces, before preparing and eating food or feeding children, before and after using the toilet or cleaning. Covering the mouth with bent elbow while sneezing or coughing, not touching the eyes, nose, or mouth with dirty hands or spitting in public places. Cleaning surfaces and objects around and in the home regularly with disinfectants like Dettol or bleach. Observing physical distance, such as maintaining a distance of at least 6 feet or 2 meters between other people. Avoiding social gatherings and shaking of hands or hugging people, as well as unnecessary travels. And staying at home. Community members can help identify high-risk people in the community, such as a person who has recently traveled or returned from a country, state, or community where there is COVID-19, and also people who have had contact with a confirmed case. Please note that such persons should immediately be reported to the officer in charge of the PHC or a traditional leader. Remember, refer to the nearest primary healthcare facility community members who require routine services such as immunization, antenatal care, delivery, and those with other symptoms not related to COVID-19. Do not make physical contact. Your safety is important. Follow all the advice in your key messages. Take responsibility. Stay safe. This video is brought to you by the National Primary Healthcare Development Agency in collaboration with Federal Ministry of Health and Development Partners.